In April 2017, IUHW will newly establish a School of Medicine in Narita, an international city in Chiba Prefecture. IUHW was founded in 1995 as Japan's first comprehensive university specializing in health and welfare. By offering advanced education taught by leading authorities, as well as well-organised environments for clinical training, IUHW is dedicated to developing health and welfare specialists who will contribute to team care medicine. Currently, 7,500 students are studying at the 5 campuses and graduate schools. IUHW has made remarkable achievements in Japan in terms of consistently high pass rates of national examinations and a 100% employment rate of its graduates. With the perspective of fostering professionals in the fields of health and welfare who will be contributing to the international environment, IUHW has been actively engaged in international projects, including various collaborative research activities and training programs. As well as being engaged in the telepathology and diagnostic imaging project in Vietnam and China, IUHW has also been actively promoting international symposium and medical cooperative activities in various countries. Furthermore, IUHW has been accepting a number of healthcare professionals from Southeast Asian countries every year in order to develop specialists in the fields of health and welfare. IUHW has also been conducting exchange activities with universities, hospitals, and institutions overseas. IUHW has so far concluded partnership agreements with universities and institutions in 15 countries or regions, and has been actively implementing exchange programs of faculty and students. IUHW Group, which started out with hospital management, has a history of over a century. Today, IUHW Group employs 9,500 staff members, including doctors and faculty, mainly at IUHW, and has become one of the leading complex organisations offering healthcare, welfare and education in Japan. The group has an extensive range of attached facilities. IUHW owns 4 university hospitals. In addition to these attached hospitals, IUHW Group has attached facilities including IUHW Clinic, Speech and Hearing Centre, one of the leading institutions in Asia, Care Facility for the Elderly, and Home Care Centre. One of the university hospitals, IUHW Mita Hospital, has been accredited as a cancer treatment hospital designated by the Tokyo Metropolitan Government. Furthermore, IUHW Mita Hospital passed very rigorous standards to receive the Joint Commission International Accreditation, which has only been awarded to 11 hospitals in Japan so far. JCI awarded IUHW Mita Hospital the highest score of any of the previously awarded hospitals in Japan. The IUHW Group has a total of around 30 facilities acting as clinical research centres for medicine, which closely coordinate with IUHW in education and research. Among these centres, Sano Hospital, which is widely recognised as the most famous private hospital in Japan, is used by many from the political and business elites, as well as well-known public figures. The number of deliveries performed annually exceeds 1,500. The hospital prides itself on the extensive medical care system provided with 150 full-time doctors serving 113 beds at Sano Hospital, together with the Sano Birth Centre and the Sano Medical Centre, established adjacent to Sano Hospital. Each of the university and affiliated facilities is equipped with state-of-the-art equipment for conducting tests and treatment. Students can therefore acquire practical skills by receiving training at these facilities. The university and affiliated facilities are headed by top-level doctors in Japan, including Vice Chairman Masaki Kitajima, past president of IUHW. These representatives draw on their past experience and accomplishments to supervise young doctors and are committed to realising further enhancement of the medical care system. So, what is the process for receiving a doctor's licence in Japan? In Japan, the academic year begins in April and ends in March. Most schools of medicine accept about 100 students each academic year. While the admission procedure for entering a school of medicine varies slightly across different universities, there are generally first and second phase screenings. Entering medical school is very competitive in Japan. In the 2016 academic year, the total number of enrolment in schools of medicine was 9,260, corresponding to less than 1% of the 18-year-old population, which was 1.2 million. In order to receive a doctor's licence, students need to be first admitted to a school of medicine, take the 6-year regular medicine course, and finally pass the national licensing examination. The pass rate for the national licensing examination is around 90%. Once they pass the examination, they can practice medicine after completing at least 2 years of clinical training. Currently, there are 81 universities in Japan that have a school of medicine. The 82nd School of Medicine in Japan will be established by IUHW. IUHW School of Medicine will be in the international city of Narita, in front of the Kozuno-Mori station on the Keisei Railway. It is a perfect location, just 15 minutes to Narita Airport and 1 hour to Tokyo's city centre. The new School of Medicine, with a strong emphasis on globalisation, will provide medical education that meets global standards and will foster doctors who, with their advanced general practice abilities, can play active roles overseas as well.
Since the establishment in 1995, International University of Health and Welfare has brought up over 19,000 medical and welfare professionals in total, and has also constructed a wide network with many related facilities in and out of Japan. Based upon these achievements, we will open a School of Medicine, taking advantage of the most advanced software and hardware. Many experts in the fields of medical science, clinical medicine, and medical education will realize development of medical doctors who have both comprehensive clinical abilities and international ways of thinking.
The new School of Medicine brings together leading experts in the field of medicine. Dr. Takahiro Amano, Dean of the Graduate School and Chairman of the Committee on Preparations for the Establishment of the School of Medicine, is an expert who has long been involved in medical education as the first director of the Medical Educational Centre of Keio University. The School of Medicine welcomes, as its Dean, Professor Kiyoshi Kitamura, who is currently in charge of the medical education programs of Faculty of Medicine at the University of Tokyo. Supervision of students is provided not only by people from the top-class medical universities in Japan, but also by experienced professionals who have been engaged in clinical practice and teaching at universities overseas, such as Harvard University, the University of Oxford, Stanford University, and the University of Pittsburgh. A majority of the courses are conducted in English, so that students can develop the ability to provide clinical diagnosis and conduct conferences in English in the future. IUHW School of Medicine offers advanced medical education that goes beyond standards set by the World Federation for Medical Education. In addition to offering a 90-week clinical clerkship, the program includes overseas clinical training lasting over 4 weeks as a compulsory subject, a curriculum that integrates basic and clinical medical sciences, small group learning, and cutting-edge education using state-of-the-art simulators. The Centre for Medical Education will be established under the direct control of the President, with 25 full-time faculty members working to ensure the quality of the education. In the coming years, IUHW plans to open a graduate school of public health focusing on infectious diseases, international health and health policy, as well as a graduate school of medicine. Of the 140 students enrolled, 20 international students will be accepted from overseas, including Southeast Asian countries. They will be trained to become leading professionals in their home countries. The school will provide a dormitory for international students, as well as extensive services to support their daily lives and studies in Japan. The tuition at IUHW School of Medicine is the lowest among Japan's private schools of medicine. This tuition will be set even lower for the students within the top 10% of academic performance. IUHW will establish a new scholarship program with the goal of fostering doctors who will become future leaders in the field of health and medicine in their home countries and contribute to their development. For more details about tuition and scholarships, please visit our website. In 2020, IUHW Narita Hospital will open near the School of Medicine. Narita Hospital will establish centres such as the International Remote Diagnosis Centre, the International Research Centre on Infectious Diseases, and the International Training Centre on Medical Equipment. In addition, the hospital will place staff members in order to accommodate 10 different languages, will arrange meal services that can be customised to the diets of different countries, including halal food, and will set up religious facilities. IUHW aims to develop a global hub hospital with state-of-the-art medical equipment and world-renowned doctors.
Hello everyone, I am Dr. Yoshio Yazaki, the Chancellor of IUHW. We aspire to foster doctors of the next generation, namely tomorrow's doctors, who would undertake not only the latest medicine and healthcare, but doctors also having ability of general clinical practice. They would play an active part globally in the medical and healthcare field. Therefore, we would like to expand the innovative educational system far beyond global standards. Our faculty consists of foreign and also Japanese doctors with extensive educational experiences overseas. They have gathered sharing the same ideal with IUHW. Now, everybody, let's become the pioneers in opening a new field of medicine and healthcare and cause a big new wave together. Thank you for your attention.
Under the guidance of leading authorities in Japan and overseas, IUHW School of Medicine will offer a highly globalized medical education in an exceptional learning environment with state-of-the-art facilities, and will foster doctors who will play active roles overseas. The school is scheduled to open in April 2017.